Hi, my name is Siobhan Kehoe, and I am currently a practicing gynecologic oncologist at UT Southwestern Medical Center. I joined this institution in 2009 after completing my fellowship in gynecologic oncology at Memorial Sloan Kettering Cancer Center in New York City. What is endometrial cancer? Endometrial cancer is actually the most common of all the gynecologic cancers, and fortunately, in most cases, it is very treatable. The most common endometrial cancer is a cancer that develops in the lining or cavity of the uterus. While there are different types of cancers that can develop from this lining, the most common type is associated with excess circulating blood estrogen levels. One of the most common risk factors for excess estrogen is being overweight or being obese. More rare endometrial cancers are those that develop from the actual muscle of the uterus itself, but these are much less common. How is endometrial cancer diagnosed? There are symptoms that should prompt the gynecologist to proceed with an endometrial or uterine biopsy. An endometrial biopsy is a sampling of the uterine lining. This biopsy can be done in the office or in the operating room through a procedure called a dilation and curettage, or simply a D&C. In both cases, an instrument is passed into the uterus and used to obtain tissue from the inside of the uterine cavity, or from the uterine lining. This tissue is then sent to the pathologist, who will analyze the tissue to make a diagnosis. An ultrasound can also be performed to assess for other anatomical issues, like uterine polyps or uterine fibroids, but ultimately, a biopsy is obtained to make the diagnosis of endometrial cancer. It is important to know that there are symptoms that are associated with endometrial cancer. What are the symptoms of endometrial cancer? Postmenopausal bleeding is a very important symptom that suggests that there is a problem within the uterus. Therefore, any woman who is postmenopausal, meaning that their menses have completely stopped, who then notices or experiences any new vaginal bleeding or vaginal spotting, should tell her gynecologist, who will then proceed with a uterine biopsy. The other symptom is a change of her normal menstrual cycle. Therefore, any premenopausal woman, a woman who is still having regular menses, who then notices any change in her menstrual cycle, for example, her cycle is longer in duration, or associated with heavier bleeding, or associated with new clots, or her menses are coming more often, should notify her gynecologist, who will then proceed with an ultrasound and potentially an endometrial biopsy. How is uterine cancer treated? For uterine cancers that are confined to the uterus, the initial treatment for the majority of cases, and particularly for women over the age of 45 years, is surgical resection, meaning removal of the uterus and the cervix, along with both the fallopian tubes and both ovaries. In some cases, removal of the lymph nodes is also done to determine if the tumor has spread. In early stage disease, surgery usually is all that is needed to treat this cancer. In more advanced cancers, it is a combination of surgery, radiation, and chemotherapy that is used to treat this cancer.